Some radiologists have difficulty distinguishing between a pulmonary, a bony and a skin lesion when that's projected on the chest x-ray. This video should give you more confidence in determining whether a lesion is within the lung, within the bone or within the skin. This is a frontal chest radiograph showing multiple lesions projected over the lung fields. Note that I use the word projected because at this point I'm not entirely sure that they are definitely within the lung, and it leaves an option open for me to consider the anatomical position being in the lung, the skin or the bone. These are actually cannonball pulmonary lesions. They overlie the bone, they overlie the skin and they overlie the lung. But because they lie within the diamond, I know that the diamond is devoid of bone, and so these are likely to be lung or skin lesions. Now, if they were skin lesions, it is likely that because they are multiple, that the skin lesions will be present elsewhere other than just the lung fields. And therefore I can work out by a process of logic that these are highly likely to be pulmonary lesions and not skin lesions. And I can definitely say that they are not bone lesions because the diamond is not clear. The lesion protrudes into that diamond, which is devoid of bone. Therefore it can't be a bone lesion. I've done a zoom of the chest radiograph and it clearly shows that the diamond, which is the area which doesn't have bone overlying it, contains the nodule. And it tells me without a doubt that this is unlikely to be a bone lesion, otherwise the bone lesion would just be confined to where the bone is. So it tells me there's a skin lesion or a lung lesion, and because I don't see any lesions outside the lung fields, it must be a lung lesion. On first impressions, looking at this chest radiograph, it looks as if the patient has multiple pulmonary lesions. But actually, if you look at the diamond, there is no lesion projected in that diamond space. And the lesions are only seen where you have bone. The important thing to remember is to look, and you can see that there are sclerotic lesions outside of the lung fields in the bones, and none of these lesions are purely projected over the skin. So this is a patient who has prostatic sclerotic bony metastases. Here is another example where there is an apparent lesion projected over the lung, again here and one here. Now clearly none of these lesions lies exclusively within the diamond, and so these could be lung lesions or bone lesions. The more likely they are to be bone lesions is directly proportional to the number of lesions that are projected over the bone. So this is yet another patient with prostatic sclerotic bony metastases. All of these lesions, although at first sight appear to be projected in the lung fields, none of the diamonds contains a nodule, and so these are sclerotic bony metastases. If you look further afield outside of the lung fields, you can see sclerotic bony metastases in the glenoid and in the acromion. If patients have skin lesions, they can often be projected over the lung fields. There is one small nodule projected over that lung field, but it's more likely that because the patient has multiple neurofibromas, that this is going to be a neurofibroma. The problem with the chest x-ray is you cannot be exact about this, you can only give a probability. Here is another patient who has neurofibromatosis. You can see the neurofibromas projected lateral to the lung fields, but there are also apparent nodules projected over the lung fields. The scoliosis in this patient and the previous patient are compatible with neurofibromatosis. Solitary lesions present a bit more difficulty. Here is a solitary nodule projected over the lung field. Now you can see that some of that lesion lies in the diamond, making it unlikely to be a bone lesion. But because it's a solitary lesion, I cannot be sure whether it's intrapulmonary or lying on the skin. Here is another patient with a lesion projected over the bone, but just a little bit of that lesion is projected in the diamond, making me think that this could be a lung lesion. But because it's solitary, I cannot be sure that it is not a skin lesion. And in fact, when the patient undergoes a CT scan, you can see the skin lesion here. Now, it's very subtle, but this was noticed because the radiologist reporting the CT scan could not see an intrapulmonary nodule, so looked further afield to explain the appearances on the chest X-ray. This patient underwent prone HRCT scanning, thereby revealing the papillar nodule. So in summary, for multiple lesions, you need to ask the question, are those lesions projected exclusively over the lung fields? If the answer to that question is no, it's a fairly straightforward scenario, and you're either dealing with a bone or a skin lesion. And the way to work out whether it's a skin lesion is to look and see if you can see a lesion where there isn't any bone overlying it. If that is true, it's a skin lesion, most likely. Now, if the lesions are projected exclusively over the lung fields, you need to work out still whether it's in the bone, the skin, or the lungs. Now, skin lesions tend to involve the skin over the lung fields and beyond. But actually, a bone lesion could be confined to the ribs. So you need to have a look at the diamond and ask yourself the question, is the diamond clear? Now, if the diamond is not clear, it means that you've either got a skin lesion or a lung lesion, but it can't be a bone lesion because within the diamond there is no overlying bone. And so it could be a skin lesion or a lung lesion. And you then just need to bear in mind that skin lesions tend to involve the whole of the skin, not just the skin overlying the lung fields. If, however, the diamond is clear, this could still be a bone lesion or a skin lesion. Statistically, it could be a lung lesion, but it's less likely that the lung lesions, if they're multiple, will leave the diamonds clear. And therefore, you're dealing with a skin or a bone lesion. You apply the same principle, look at an area on the chest X-ray where there is no bone, and if you can still see the lesion, it must be skin. Don't forget that this particular logic doesn't apply very well to solitary lesions, because solitary lesions, when projected over the lung fields, assuming they are not overlying the diamond, could be in bone, skin or lung. And so it's much more difficult to apply that principle. So